Health Centers in Schools is actually an innovation in the healthcare system. What we are doing is bringing primary care and mental health services that are totally integrated into school systems. We work hand in glove with the physicians in the community to manage the care of students that have chronic disease.
We consider health centers a family of services within Our Lady of the Lake Children's Hospitals. They are an extension of us and our brand and our mission.
Our mission is really simple. We keep kids healthy so they can stay in school and learn. We do it by offering an array of services and by bringing providers to school.
A lot of times when children become teenagers, they don't go to the doctor as much. So we really get a chance to see them, to care for them and to teach them a lot.
All the health screens that we do to see if kids have hypertension and diabetes that it hadn't been caught before, and so just their physical health is very much impacted.
Diabetics, asthmatics, kids with chronic care conditions, they need that partner in the school system, and this is an ideal opportunity to develop those relationships.
To have access here at school is a big help because recently in January I was diagnosed with epilepsy, and it's been hard to cope with it, so it's easy access for me to come to the school nurse and get help when it's needed when I'm feeling sick.
Not only do we have the 8 school-based health centers and the school nurse program, we also have mobile optometrists that come on site and do eye exams and bring glasses back to kids. And then in most of the elementary schools, we have mobile dentistry. We're actually managing care of about 45,000 children.
It's very important that they stay healthy, and that's why we ask that all of our students have the flu shot every year, and that we want them to do everything to stay healthy.
We see kids for vaccinations, try to get a lot of comprehensive physicals done.
By having the health center on our campus just helps us tremendously with the number of health problems that we have, and it helps us academically because it allows students to remain in class rather than missing a whole day of instruction.
This school is so structured and you don't want to miss any school for something, minor that can be fixed. So most people like myself try to stay at school as much as you can. And with having health care here, it can help you to better manage whatever you're dealing with to get through the day and to get what you need done.
The model that we've implemented in East Baton Rouge Parish really sets the stage for models all over the country. It relieves pressure off emergency rooms, it relieves pressure off the parents taking them to the doctor, our employers around the city. That employee is, really shows up to work, and it's just all around economic benefit for Baton Rouge.
The health center benefits my education because when I'm not feeling good, I can come here, and when I get better, I can just go back to class.
If something happens, you don't have to leave school miss valuable school time. You could just see someone here.
As a nurse here in the clinic, I interact with the social worker a lot because kids who come in with the same kind of complaint over and over, whether it's a headache or bellyache, and there's not anything that I can detect that's causing these things over and over again, usually it's something more mental or stress related, and that is our social workers' specialty, and so it's great to have that resource to be able to send those kids over there so that she can kind of dig a little deeper than just listening to their belly and doing all the different things that I do health and physiological wise. She can go in a little deeper mind wise and see what's going on.
One of the primary roles that I take with kids is being an advocate for them and a role model for them, but letting them know and understand that someone is here to listen to them and hear their side of the story and to support them in figuring out their own best way of dealing with whatever's going on in their life.
When you're dealing with a community with a poverty rate such as we have in the city, having medical services like that available to underprivileged children and affluent children is a plus for the city and a plus for the school system.
I think it means just having a more healthy community, more healthy family, because of course we get the families involved whenever there's a kid having an issue, whether it's they don't know how to eat healthy or they don't know what their asthma triggers are and what to stay away from. And so for me, I feel like it's prevention and education for the community.
If you're sick, you're just not going to do well in class.
So it's just important to be healthy.
Our sole purpose is to keep kids healthy so they can stay in school and learn. We really and truly are not just working on health outcomes, even though we are health people. We are really working also on educational outcomes.
There's a benefit to Baton Rouge. Healthy children just permeates into a healthy community. And when they're well educated, safe and secure and healthy, we can expect positive things from our youth in the community.